Hello, my name is Bailey Whipple, and my presentation is on sedatives, what they are, and just bringing awareness to them. All right, so what is a sedative? So, a sedative is any prescription medication that slows the activity of your central nervous system, and that is including your brain and spinal cord. So they have a wide range of uses in medicine, and their potency and duration vary considerably from drug to drug. So some of the effects of sedatives are feeling relaxed, decreased anxiety, sensation, and muscle function, drowsiness, shallow breathing, slowed heart rate, and memory interruptions. So the misuse can be very dangerous for these drugs because it can result in substance use disorder and ultimately overdose. They have a high addiction potential because some of them create a sense of euphoria, which can be pleasant to some people, and that those people can soon develop a tolerance to these drugs, which can lead them to using more and more of it and to try to get that original relief that they experienced. And it can become a craving or a compulsion. So, what are sedatives used for? They're typically prescribed for anxiety disorders, seizures, panic disorders, sleep disorders such as insomnia, and bipolar disorder. So, what are the types of sedatives? Today, we're going to go over three different types. The first and most common are benzodiazepines. These are depressant drugs that slow down the messages that travel between your brain and body. They're mainly prescribed for anxiety disorders, insomnia, and seizures. So here we have Xanax, which is also known as alprazolam. Here is Valium, or um, the generic name is diazepam. We have Restoril, the generic is temazepam, and here is Klonopin, the generic is clonazepam, if you know them better by those names. Next, we have barbiturates. These cause you to relax or feel drowsy. They stop or prevent seizures and insomnia. So, two common examples of barbiturates that I see in the pharmacy are primidone and phenobarbital. And lastly, we have hypnotics. So these drugs mimic hypnotic effects and work similarly to benzodiazepines. They're most effective in treating insomnia and related sleep disorders. So some of the examples that I have here are Sonata or um, azopiclone. Might have pronounced that wrong. And then we also have Ambien, better also known as Zolpidem, and then Lunesta. And here is the name of that, Esopiclone, also kind of strange name. And these are commonly referred to as Z drugs. So, how can we prevent sedative use disorder? The most important thing is to follow the instructions from your provider if you are prescribed one of these medications. You also never want to share these medications or sell them because they can be very dangerous in the wrong hands. And you also want to store it in a safe and secure place. And always safely dispose of these prescriptions if you're ever left with any leftover once you've completed your treatment. And some places that you can do this that I know of is the police department, or at my CVS pharmacy that I work at, we have a pharmaceutical disposal bin that people can drop off their prescriptions in. And that's all. Thank you so much for listening.